So hello, everybody. Welcome back to the amazing seminar or lecture or the conference. No, it's not the conference. But anyway, thank you for joining back again. And today I'm going to talk about some estimating unpaid care sector. You've already heard about how to account, like there's some problems and some benefits and things about accounting unpaid care sector from Nancy's class yesterday. So today I'm going to go a little deeper and then show you how I estimated the unpaid care sector using the Korean time user survey data. Okay. I'm sorry. Okay. Let's see how the day of women with a young child looks like. At 6 o'clock in the morning, she wakes up to her child's crying. 7 o'clock, she makes a breakfast for her family, and her older child is off to school while she remains with her youngest child all day long. And at around 10 o'clock, the first picture in the second row, she's doing laundry while a child is in a stroller. So that's basically a woman with the two children, a time diary. Okay. Well, she works all day long, but this type of unpaid care work is invisible and therefore unvalued, as her husband doesn't really recognize his wife's unpaid work, as you can see in the screen. So, okay. Nancy talked about why GDP should be the only measure of well-being yesterday. And first, let's consider what's included in current GDP. Lots of things. I'm not going to go into details like which one is included, but in the introductory economic textbooks, it explains that in order for something to be included in GDP, it has to be something that's actually produced. It has to be something that's not used to, it has to be something that is actually produced and then not used to produce something else. And it has to be produced here, wherever you are, but not somewhere else. Until 2014, that something also had to be legal. In fall 2014, Eurostat, Statistical Office of the European Union, advised the member countries to start incorporating illicit activities in their national accounts, including drug trafficking, prostitution, and illegal alcohol and tobacco consumption when calculating the size of their economies. The goal was to make it easier to compare GDP across borders within European countries. The Netherlands, for example, already counted the cash generated by legal marijuana sales in its national accounts. Germany, where prostitution is illegal, tallied up the money from it. But aside from interesting cross-country comparability, perhaps this shift came about from the recognition that not counting illicit activities produced the incomplete measures of national economic activity. One would think then that a similar logic might apply to other activities not currently accounted for in GDP, like unpaid care work. So why not unpaid care work? There has been a lot of resistance, and those mounted on three conceptual grounds. First, while household production is relevant to thinking about well-being and standards of living, it doesn't really give a rise to wages or salaries. So that's why we should not really include it in GDP. And second, it's considered simply too difficult to measure. And third, where measurements have been attempted, the resulting estimations are considered too crude to be useful. However, as Nancy showed yesterday, the size of unpaid care work is quantitatively large, and now it is not too difficult to measure the number of hours devoted to unpaid care work using available time use survey data. And in my opinion, it's hard to imagine a worse estimate than the current value of unpaid work, which Nancy said, which is 0. So failure to assign value to unpaid care work can result in incomplete measure of living standards and economic output. Care work has also a paradoxical element to it. It's a source of social well-being, personal satisfaction, but also economic vulnerability. So what are we trying to do here, unpack here, is the economic vulnerability. So many countries have measured and assigned values to unpaid care work. These values have varied depending on the methodology, ranging from 14% of GDP in Canada in 2010, I believe, and 33% for Switzerland, and to 56% for the UK. So remember this 56% of GDP in the UK, which is a much higher than compared to other countries. So today's goal is, how can we measure unpaid care work? And once it is measured, how can we assign value to it? So my goal in this session is to demonstrate the quantitative significance of unpaid care work to the Korean economy in order to help develop better policy, hopefully. Okay. So there are 3 sets of data that you need to do any evaluation exercise. One is the time use data. There are Korean time diary data was available, so I used that 2009 and 2014. And also you need a wage data, which I use the survey report on labor conditions by employment type data for wages. And then you need a census population estimate. So there are 3 types of data. And the Korean time use survey data, if I give you just a little background, it is cross-sectional data, and it has everybody who's a house member is 10 or older. Their time diary is included in the Korean time use survey data. And it asked about previous 2 days, record how they spend their days. So it's not just 1 day, but 2 days. And the survey asked about main activities as well as secondary activities. And the Korean time use survey data is collected using a recall interview method through a diary of activities in which all household members, 10 or older, from each household report their primary and secondary activities for 24 hours in 10-minute intervals for 2 consecutive days, from 12 a.m. the day before the interview to 12 a.m. of the day of the interview. Okay. I think I've already mentioned. Well, one thing that I'd like to just mention is the difference between the time diary and the stylized effect, stylized questions. So how much did you spend on unpaid care work yesterday compared to please write diary of your day. And when you compare them, sometimes because of a social desirability bias, people tend to overestimate their unpaid care work, especially childcare or some other work. For example, at the University of Massachusetts Amherst sociology department once surveyed professors how much time they spend on research, and it was tremendous number when you ask the question in stylized format compared to the diary format. So there is a little discrepancy, not little, but there are some significant discrepancy between these two different methods. Okay, here is an example of a paper diary that respondents in Korea filled out. The first column is a time slot, 10-minute time slot. And the activity is recorded by 10-minute intervals. Then respondents record the primary activity they were engaged in during that time. And then there's a location question, and then who they were with. Then secondary activity they were also engaged in. It's a pretty standard paper diary that you may find in other countries as well. So definition of unpaid care work that I used is interactive care, the hands-on care that you heard yesterday, reading aloud to a child, feeding and bathing a sick adult. Those are kind of care is included in the interactive care, and support care is housework, different types of housework, cooking, shopping, cleaning, and organizing the household. And supervisory care, as you have seen yesterday, that it's important and is significant, and it's beyond activities. It's more of a responsibilities for adults minding a child or minding an elderly, sick, for those who can't really take care of themselves. So let me dig a little bit more on the supervisory care. So in order to measure supervisory childcare, which is beyond activity, a few countries have captured the following questions. In the American Chinese survey data, there was a question: was a child under the age of 13 in your care? And in Canadian survey, during what periods of the diary day were you looking after a child? And in the New Zealand, the Chinese survey data, during what periods of the diary day were you responsible for someone who could not take care of themselves? So those are kind of, it's not really activity, but it's beyond activity, and it's kind of supervision and responsibilities rather than a type of activities. So we have seen the child care, and then let me give you some examples of elder care or older, any adult with the disabilities or those who need some assistance. So supervisory adult or elder care, however, is not really available in the time user survey data. The elder care experts have developed, however, a scale or measure called the caregiver vigilance scale. This isn't a diary measure, but the measure asks how much responsibilities you as a caregiver have by asking how long can you leave a care recipient alone, and about how many hours a day do you feel the need to be there or on duty to care for a care recipient. So these are kind of responsibilities, but it's not really, it wasn't included in the time user survey data yet, but I was able to find in some other, the elder care literature. So let me show how significant supervisory care is using the American Time User Survey data from 2003 to 2019. 19. Sample here is women and men with living with at least one child under the age of 13. Women spend, the left-hand side column, women spend about 6 hours on supervisory care, and the men spent over 4 hours on supervisory care. If we combine time devoted to interactive as well as the supervisory care, women spent over 8 hours a day, and men spent over 5 hours a day. However, if you only account for interactive activities, which often done by either time user researchers and anybody, like feeding, changing diapers, and other hands-on activities only, then women only spent about 2 hours and 1 hour for men. It's absurd. If you know, these people are, and if you do it, the sample is for those living with a child under the age of 5. It doesn't really increase much. It does increase like 1.5 times more, but compared to those with the children under the age of 13, but it doesn't really increase huge if you are only accounting for interactive childcare. So why don't all time user surveys expressly ask about this supervisory care? So it should be noted that the Korean time user survey data neither assigns a separate category to supervisory care for children and elderly care recipients, nor contains explicit wording pertaining to supervisory care within any of the listed categories. So I need to come up with some alternative ways to capture supervisory childcare in Korean time user survey data. So there are 2 ways. One is using the secondary childcare. So what else were you doing while you were doing your primary activity? And if the respondent answered they were engaging in childcare, then I took that as a secondary childcare. And then who were you with during whatever activity? And if they answered they were with a child under the age of 13, sorry, under the age of 9, because that was a Korean time user survey data restriction. Under the age of 9, then I capture them. I capture it as with a child kind of time category. So these are my kind of alternative way to capture supervisory care that's really not available in Korean time user survey data. So ta-da! This is unlike what we saw in the American time user survey data. It looks like the interactive childcare seems to be much greater for in Korea. So these are for 2009 and 2014, and these are mothers with living with at least one child under the age of 9, and this is hours per day. So for those who are living with a child under the age of 9, 3.7 hours a day spent on interactive childcare. And secondary childcare is just 0.05 hours per day and 0.05 hours per day, again, with the time with the children. The problem with the secondary childcare in Korea, though, is they captured secondary activity only if the other person, or only if the secondary childcare is only measured when child is not just in the background, but they are actually engaging in something, doing something together with the mother or with the caregivers. So this is not really a responsibility. So none of these measures, secondary childcare in Korean time user survey data and time with the children, these 2 measures are not really supervisory care in that was used in the American Time User Survey data or Canadian survey or New Zealand survey. But I had to come up with something. So this is what I had. So the unpaid care work that I have in the American time, in Korean Time User Survey data, I have this 9 different categories of unpaid care work: childcare, elder care, cooking, cleaning, doing laundry, home repairs and maintenance, shopping, organizing, managing, and other household chores, and travel related to unpaid care work. And within childcare, there is a physical childcare, developmental childcare, travel related to childcare, and supervisory, which is a secondary childcare, and time with the child, childcare. And time with the child and the secondary childcare is, those are not overlapped with the primary childcare, interactive childcare. So once time devoted to unpaid care work is measured, it is a time to estimate its values. There are 2 ways: input valuation and then output valuation. And let's first look at output valuation. So output-based method is to find the market price for goods and services produced at home. For instance, the value of a child care can be measured in terms of the price of sending a child to a nursery or a child care center. So that could be the output measure. So which country has really done this output measure? The UK has used the output valuation method for their 2015 and 2016 household satellite accounts. In general, as you saw, the value of unpaid care work as a share of GDP, the UK was the highest. It was 56% of GDP was the value of unpaid care work in my earlier slides. So in the UK satellite accounts, the way they did was doing laundry was captured. They took some monetary value from the household consumption expenditure survey. So they estimated the average household spending how much money they on doing laundry, for example. And then for elder care, they used the residential rate, which is the money that you need to pay for the services provided by a residential home, involving daily help with the personal and practical care. Or you could use a nursing home fee. However, they were worried about overestimation because a lot of people actually criticize the value of unpaid care work. Then they criticize that it's too high or overestimation. So they rather, the nursing home fee is usually much higher than the residential rate. So they use the residential rate for elder care. And for child care, they measure the time alone assumption by the different categories, age categories of child. So from 0 to 4, if you send your child to a nursery, then they'll be in nursery for, let's say 4 hours. Then the rest of hours need to be, they cannot be alone, for example. So 24 hours, I think, was assumed for childcare for children under the age of 5. And 5 to 7, they also took out some time that children were in school, and 8 to 10 and so on. So they measured those time alone sort of assumption to get how much time a child can be alone without anybody's supervision. So it is it's not an interactive childcare, it's a broader childcare measure, I think. And the other method is input-based valuation. So you consider, okay. So the input-based methodology involves the imputation of a shadow price of labor time using the time user data. With respect to the replacement cost approach, one can ask how much it would cost to hire either a substitute or a specialist and multiply their wage rate by the number of hours of unpaid care activities. If specialist wage is not available or doesn't vary very much across occupations, then generalist wage method is often used. The same wage for different types of activities can be assigned within the generalist cost approach. There are several wage options you can use. One is minimum wage, half of median wage, housekeeper's wage, or manager's wage if you want to go really to the top. So anyway, the specialist wage method is mostly recommended if it is available, if the wages for each occupation is available. And that's the one that's highly recommended. So I did have a specialist wage, and for each type of activities, I assigned a different wage to those activities. And these are the list of wages of occupations that I used. And domestic chores and infant rearing help was the lowest, and the administrative and business support management occupations were the highest. So not only using the specialist wage method, I also used the generalist wage for lower bound using the domestic help wage, and for upper bound, I used the manager's wage to see how it varies, how much it varies. So the monetary value of unpaid care work in Korea was computed using the following procedure. Again, it's very simple. You calculate time, how much time they devoted to unpaid care work, preferably into different types of unpaid care work. And then you calculate the wage, or you find the wage of certain occupation, and then you multiply those wages, and you get the population estimate. You assume that everybody's doing pretty much, this kind of unpaid care work. Then you get the value of unpaid care work at the national level. So ta-da! This is the result. The first 3 bars are for 2009, and the last 3 bars are for 2014. And the first of those 3 bars is the estimation using the specialist wage, and the second bar is a generalist wage, but lower bound, so using the domestic helps wage. And the generalist wage, the third bar is a generalist wage using the manager's wage. And I broke down the by gender, how much it was contributed by women and men. And here pink is women, and then green is men. As you can see, there is a huge difference between men and women. There is a big gender difference. The specialist method is an estimate of about $413 billion, which was in 2014, which was about 34% of GDP, which is here. Okay. So one thing to note is when applying wages for men and women separately, you really need to apply the same wage for both men and women. Otherwise, your results perpetuates the gender wage gap in the labor market. So therefore, I recommend using an average wage rate for a specific occupation for both men and women. And that's what I did here. Okay, so how does it compare? Like, what does it mean? The value of unpaid care work only accounts for labor input in care provisioning. Again, this is really, it ignores the intermediate goods and capital and the raw materials that are used as inputs. So it's a lower bound, and it's probably likely underestimated. And depending on the methodology, the value of unpaid care work ranges from 22% of GDP to 59% of GDP in Korea when I used the manager's wage in 2014. And adults in Korea provided about 87 million hours of unpaid care work per day in 2009 and 92 million hours in 2014. And if I translate that into people and dollars, then that means 11 million workers would need to be hired on any given day, assuming they are working for 8 hours to provide a paid replacement for the unpaid time that individuals have spent. But in reality, there are only little over a million workers in paid care sector in Korea. So what do we need to do, go beyond? We need more frequently conducted time user surveys to go beyond. Alongside more frequent and regular surveys, we must start combining time user surveys with the surveys of income and consumption, because there are trade-offs between the two. We've seen the trade-offs, and if you earn less market income, you have to do more non-market work. If you do less non-market work, then you probably need to spend money on to buy substitutes to outsource for that work. So this is a tremendous limitation of most time user survey data, in that they don't really include any links to data about consumption or household capital. And where time usage is collected, we need to harmonize them in order to improve international comparability, which Nancy also talked about yesterday. I realize that this is a daunting prospect. It's taken more than 50 years to get countries to agree to the systems of national accounts like GDP. So, and even then there is still a lot of disagreement. So attempting any measurement effort of this scale will not be quick or easy, but we need to start, and then we need to start right away. And I also want to note that merely conducting time user survey data is not enough. As currently conducted, the purpose of measuring unpaid care work, time use survey data is, time use surveys are themselves limited by a range of conceptual and analytical problems like supervisory care. So we need to really go beyond the definition of unpaid care work in general and care work in particular, and refined. By devoting more energy to conducting time user surveys consistently, we'll be also able to do them with a greater accuracy. With the quality of time use data improved and strengthened in these ways, they provide a stronger basis for analysis that help address the objections. There are still a lot of objections you can imagine. And surely the estimates that come from these efforts will be no less reliable than, for example, the kind of guesswork involved in estimating the street value of heroin or illicit activities as European statistical offices are trying to do. So yesterday, when I observed Nancy's session, I agree that the name of the satellite account is really not what we hope to see, because it's not subsidiary, or it's not less important, or it's not subordinate. So this is my, version of a satellite account, which is, let's call it constellation instead of a satellite. And this heart is a kind of unpaid care worker constellation that I think we should carry in our mind. Okay. So I'd like us to talk about and discuss, like, can you think of any alternative ways to estimate supervisory care? And in selecting wages for replacement cost method, what kind of issues do you think it's going to occur or need to be addressed? And here I didn't really talk about the paper with Nancy in 2016 using the American Time User Survey data, and we came up with the satellite accounts using our different methods and different quality adjustments. And in the labor market, more educated people get paid more. So should we also do some education adjusted wages when we do when we calculate the value of unpaid work? Maybe, maybe not, but it's something to discuss, I think. And how can we make sure that how can we adjust the quality for wages? So for example, so if I use the cooking time multiplied by the cook's wage, does that mean my meal is equivalent quality to the cook's meal, or the meals that are prepared by the cooks, the professional cooks? So do we need to really consider the quality? Do we need to adjust the qualities here? I want to know what you think of these this types of adjustments. And for measuring care quality, I think that people are trying to also measure. A lot of social scientists that have tried to measure care quality. And what we used in 2016 paper was we adopted a care density, meaning that we adjusted using the ratio between caregivers to care recipients. So if there are two adults caring for one child, the quality might be higher. Well, depending on what the other person is doing, but you can imagine that quality can be improved if there are more caregivers compared to the care recipients. So can we think of any care quality measure in valuing the unpaid care work? And also, yes, in developing countries, I think so far I have looked at the Ghana and Mongolia, and the contributions by young adults, like those who are between 12 to 18, they're not insignificant. So what should we do about them? Do we need to include everybody's, or should we still select those are just the population at 18 and older, or 20 and older? So what are your thoughts about them? So I think we are gonna go to a breakout room. Okay, so let's dig a little more, and then I want to show just some more stuff. Oh, apparently this is my favorite cartoon, so it appears here. So let me be more professional. This is a kind of cartoon, so let me be more professional. So here is my professional slide. So time diary. It's yoga vinyasa flow chart, but each pose you can think as representing a different type of activity. Okay, so it's really not professional, I guess. So when you look at raw data, this raw diary data, it looks more like this. It depends on different country and different context, but anyway, this is a raw data view. You're looking at the raw data, and the first column is usually the time slot, 10-minute interval, and this survey starts at 1 a.m. and there are 17 time slots are shown on this slide, and then Act 1, the third column, is 11, meaning it's a sleep, and Act 2, it did ask a secondary activity, but since this person's primary activity is sleeping, so secondary activity was not answered. And then there is another column where, so it asks where you were during your primary activity, so home. So this person was sleeping at home. And were you with somebody alone? So this person answered alone. And sometimes there is a travel column and asks really about the mode of transportation. So whether you were traveling in a car or public bus or public train, and so on. So those are kind of data viewer for those who don't have access to the microdata. This is more or less looking like a microdata. Okay. Yeah. Okay. So this data covers all activities across various periods. Sometimes it's only asking a day, and sometimes it's 2 days, a consecutive 2 days for American Time survey data. Sometimes it's a full week. It's very expensive, but you can really see a person's time used throughout the whole week. And then sometimes it's a month. I have seen some transportation survey. They really want to look at how people use their public transportation. So there is a month survey, but it's only for traveling on public transportation. So this is not really covering all activities, but those are kind of different surveys are available for the purpose of for a different purpose. And this survey has a 10-minute interval, but sometimes 1 minute. Like the US data has a 1 minute interval and sometimes a 30-minute interval. And Ghana, I think it's a 1 hour interval. So there are 24 just time slots. And they often include some background information about the household size and household members, age, sex, and some education variables, and activity, what kind of activity they're engaged in, primary as well as a secondary, or sometimes a supervisory. And then where and which transportation you used for that activity, if it is related to traveling. And these days, I think it's been a while. It's been like 5 years since people started looking at more device use. So ask another question. While you're doing this primary activity, did you use any device? And if you use the device, which one was it? Was it computer? Was it smartphone and so on, or tablet? So then you can really get the shopping, online shopping versus in-person shopping kind of activities. And a lot of management is done through phone or through computer, the online based. So they are kind of newer sort of function to the time series survey data. And a lot of surveys now have try to capture subjective well-being. How happy are you? What was your subjective well-being? A scale from 0 to 10, 1 to 10, 1 to 7. Like there are various surveys that have looked at really subjective well-being for each activity that you listed. And there are some special modules linking to the parental leave questions or workplace flexibility. So there is a primary time use survey data, and then there are special modules attached to the time use survey data. And in particular, the American Time Use Survey data. Now there is a special module for leave, whether you adjust your time at work, whether you can adjust your whether you have flexibilities at your workplace, or whether you can choose where you work, like a location. Can you work from home? Like those are kind of special questions are added to the module. And also health and drinking, eating, and in the American Time Use Survey data, there is an eating and drinking module, and it even asks your body mass index. So what kind of, are you drinking sugary drinks? Are you eating a lot of fat content, those food? So there are some more detailed information about drinking and eating, and those are possible and they're there, but it's on top of the primary time use survey data. Okay, so as you have seen, for valuing unpaid, to measure and value unpaid care work, you only need a simple method. Each low lunge, as you can see in this vinyasa flow, low lunge pose represents, let's say, childcare, and then you just add them up. Childcare happens at this period of time, this period of time, so you add them up, and then you have like one measure of time devoted to childcare. And since you guys already know, and then if you have a micro data, you can also do. Do I have that? Okay, I don't have it. You can also do transition. Mothers often they change their activity from one to the other a lot often. So it's a fragmentation. You can get the fragmentation looking at this time diary data, micro data, if you have, if it is available. And for example, American Time Use Survey data is available. It's available on the website. So anybody can download it and try to just manipulate or look at things. Okay, so since I learned that many of you are already familiar with the time diary data, I want to just share various types of time use surveys. And this is a light diary. It doesn't look like a light because really hideous color patterns that I couldn't change it because it was already baked. But anyway, this is a sample from the UK Understanding Society Innovation Panel 7 survey. And it's designed to lower both the respondent and coder, like those who need to code afterwards, their burden. So they try to reduce their burden and then include a restricted menu of activities from which respondents may select in its paper form. So this is a paper form, and it's a less detailed than the full diary data. But it's there. And this one actually collects even the secondary childcare, secondary activity. So the main activity was a sleep from 4 a.m. to 8 a.m. And then, so there is no secondary data during sleep, as I said. And then from 8 o'clock, wash for 10-minute interval. So these are all 10-minute interval. And then while I was washing, dressing, I was eating and drinking at the same time. That's possible. You can multitask. So this is throughout 24-hour, and it's supposed to be much lighter diary. So that's called the light diary. And the light diary also was used in Finland. I think of Finland 2014 data was they used the light diary. So there are 35 pre-recorded pre-coded main activity categories, and then they asked with the whom question from 4 a.m. to 4 a.m. next day. They didn't even ask a secondary activity, more location, but still you get something out of this, and it's much cheaper to conduct this life diary. And there are, yesterday Nancy talked about the caddy click and drag diary instrument. And this was developed in the UK, and they did a 9-country survey, and then it's supposed to be online. It's not paper-based, and online-based computer, not on the phone. So this is your kind of screen. You're looking at 5 different categories of activities. So there are the broader categories of personal activities, travel-related activities, work and study, and then recreation 1 and 2. And what you do is, it's a top, like there was a little thing here, there's a 10-minute interval. And then once a category is chosen, you click okay, sleep, 4 a.m. I'm starting 4 a.m. You first choose a category of activity, and then you drag how much time you have spent on these activities. So respondents can begin dragging anywhere on the timeline. You don't have to really start from the beginning, but I think they've met it. It's easier to start from the beginning. And so then this is all done. So this person engaged 1, 2, 3, 4, 5, 6 different activities. And as you can see, these are the kind of purple, no, not purple, bluish bars for sleep, and then some other activities. So time bar will only highlight the relevant period, and you can just go hover over the time bar, then you can see how much time it actually was recorded. And then after you're done recording all your activities, then some other questions were asked per period. So for example, this one is who were you with during this activity? So this is car driving from 8:10 a.m. to 9 a.m. So you can choose who you are with in this format. Okay, that was an online survey. And this is another online or app. This one is also available on the smartphone app. And it was used, the pilot study was done in Netherlands in 2013. It was a much less prettier. I mean, the pilot version is less prettier than this one. But anyway, so this is a modular online time user survey, which is called MOTUS, developed by the research group in Brussels. And they are collecting, or they have collected some time diary using this method during COVID-19 crisis to look at the really COVID-19, how much COVID has affected in people's lives. So respondents select first start and end time for their main activity of the day, and then the activity itself from the drop-down menu. So this is a drop-down menu. There are all pre-coded activities there. And right now, Eurostat is considering implementing this approach for the online version of the harmonized European time survey. I don't know whether it has gone through but all I know is that so far they are considering this method. And once it's all collected, then you can see like which one is which activity you have engaged in, which time point. Okay, then if you have a lot of research funding and want to go all in, then there is in the UK, there was this is a GPS video paper all in time user survey, time use data collected in the UK. They only did a pilot survey because a pilot of 100 people, because it was very hard to find the volunteers to do. So the way it works is you have this ginormous camera. It's not a hidden camera. So you can tell people I'm wearing a camera and then I'm taking pictures of you or of things that I see. So it's a facing, as as you're seeing. So these are the pictures that are taken from this video. Very cool, big video thing hanging on your neck, and so this high-tech approach is combining passive measurement of the geographical position and movement. So it does have the GPS maps, accelerometers, and the camera images enhancing account. These reveal the same overall picture captured by the traditional paper diary. So these these volunteers, they not only wore this camera for 24 hours, but if you don't want to take any pictures, even if you don't want to be taking any pictures during any certain activity, you can always face down. It doesn't record a sound. So it only takes pictures every 10 seconds. It automatically captures some detail that people do not observe, but also misses some key details. So yes, it's a private question. Yeah, it's privacy question that Daniel just mentioned. And yes, because it's very heavy in data, no one wanted to really analyze this data. One problem. Two, it's highly skewed to those who are in the older age group. So the volunteers that we were able to receive, we were able to get, were all really retired older people. So it was hard to do some sort of a meaningful analysis. Not that we can't do anything for the elderly person, their time use. But anyway, this is something that somebody has done and it has worked to some extent, but not quite. So available time use data. So MTSX, multinational time use survey data, and then there is the University of Minnesota now have made the American time use survey data as well as a multinational time use survey data much easier to use. So they call it ADAS-X or MTSX, and then you can click those these links. So these links are all hidden. Hyperlinks are all hidden here. And then also American time use survey data publicly available. You don't have to sign any, the papers to have access to those data. And PSID, CDS. But for the multinational time use survey data, you need to sign some papers that you're not going to release, the raw data to. It's not even raw data, but anyway, it's a harmonized data. And many European countries are included, and some Asian countries are included, but it still has a lot of potential to be expanded. And PSID, as I mentioned, CDS is the children's time use data, and HEDIS is harmonized European time use data, which includes like a lot of the European countries. So if you're interested in, you won't get the micro data. However, you can have some descriptive analysis using this HEDIS data. And World Bank's Living Standards Measurement and Study, and I think Maria, Professor on the first day mentioned that the World Bank is trying to expand more or include more time user survey data. So it's something to look out for. And then there is a UN time user statistics. Again, these are not microdata. So only microdata that's available is MTSX and the ATIS and the PSID, and then the rest is not really microdata, but it includes so many countries, so you can see the pattern of how people in such country spend their time on different activities. And National Statistical Office, those various national statistical offices have their own collected their own data, and many of them are really restricted, but you can get hands-on those microdata. So I really recommend to use, if you know that your country's statistical office has collected those attendance data, then why not using them? So before I do, okay. So what do we need to do? So let's send lots of demanding emails to our statistical offices to develop further time user survey data and request more. Hey, you can always just email them. Hey, I'm a researcher and then trying to look at this, but these data are not available. Are you planning on expanding this data or collecting these data? So you can always demand more to the National Statistical Office. And if we do all together, I think that we can get what we want. So with the time left, I'd like us to really talk about, what are the most important elements in the time user survey data that you wish to have, or you are planning to use, and why? And if you can design your own time user survey data for your country or region, how would you do? Which kind of method would you use?